early onset glaucomas, they're 100% in the cell. They can't get out. The Dwoyne's gets out, but it's not normal, so it forms these deposits. The POAG one is in between. It's partly in the cell and partly out, and I think that's why there's both phenotypes there.
Very
Yeah.
interesting.
Yeah, it is very interesting. Thank you. Yeah.
It's excellent talk again. I was wondering how's data sharing happening with the consortium, because that's a very critical question in most of the collaborations that we have, especially for genomic data and DNA related data.
Yeah, thank you for that question. It's an excellent question. And so for the GWAS, all of those groups that I showed on the world map had collections of cases and controls that they had phenotyped and genotyped. What we did for each site is we asked them to do the analysis. We had an analysis script that we shared among all the sites, and we had each site do their own analysis and then share the summary statistics with us, so that there was no sharing of individual level data, which is usually what the problem is.
That's a good plan.
Yeah, no, it worked really well. And I think going forward, that's a great way to do it as well. Yeah.
I'd also like to thank Dr. Shailaja for organizing this on behalf of the Genetic Eye Consortium. So we all know what is the gene therapy, and thanks to the advancements in medical science and technology, particularly the mapping of human genome, researchers have been able to pinpoint specific genes associated with a number of inherited eye disorders of the retina, and these includes the Leber congenital amaurosis, the Usher syndrome, Stargardt's disease, retinitis pigmentosa, excellent retinoschisis. And we have Professor Kumar Manikvel here who worked on the RP65, and which has led to the Luxturna therapy now. And I think thanks to people like Kumar who has worked from India along with the rest of the collaborators. And some eye diseases are caused by a defect in a single gene passed down through family members, and most affect the retina or the choroid. And the abnormal gene keeps certain eye cells from working properly, which can lead to vision problems. And sometimes these problems get worse over time. And that's why Arnold Sosby, in his textbook written Ophthalmology is the Playground for Genetics. And gene therapy works by replacing or inactivating disease-causing genes. In some cases, gene therapy introduces new genes into your body to treat a specific disease. With gene therapy, healthcare providers deliver a healthy copy of a gene to cells inside your body. This healthy gene may replace a damaged or a mutated gene, inactivate a mutated gene, or introduce an entirely new gene. In gene therapy, these faulty genes are replaced with healthy copies, and the working genes are delivered to eye cells in the retina during the same procedure. And the gene addition inserts a new copy of gene into your cells, and gene silencing transfers genetic material that prevents the activity of a gene that's already in a cell. And gene editing modifies parts of your DNA by altering or deleting elements within your gene. Our President of India launches India's first homegrown gene therapy for cancer. Accessible and affordable CAR T cell therapy provides a new hope for the whole of humankind, and that's what is there in the press release, which is released recently. And India's population recently surpassed China's, making healthcare a crucial issue for the coming decade. Genetic diseases such as sickle cell anemia, beta thalassemia, and retinal dystrophies are prevalent in India due to consanguinity and founder effects. Therapies such as CRISPR-based gene, which are both the speakers mentioned, editing need to be available in India to reduce the dependence on costly imported drugs, which has been published by Arka Ghosh from Bangalore. In India, healthcare is mainly community-based, and there's little awareness of rare genetic diseases, although this has recently improved. The pandemic demonstrated India's ability to scale up production of biologicals such as vaccines, and there is now governmental and non-governmental support for gene and cell therapy programs, including the sickle cell gene editing mission, the development of chimeric antigen receptor, the CAR T cell therapy, and indigenous vaccine development. And we are approaching a critical inflection point for gene editing technology in India, driven by the convergence of three critical factors: patient awareness, evolution of indigenous technologies, and availability of regulatory approval pathways. And the types of gene therapy, as I mentioned in the beginning, the replacement gene therapy, growth factor which can be added, and then the optogenetics involves genetically altering ganglion cells to become photosensitive. This would be useful in retinal degeneration, in which the photoreceptor has already suffered extensive damage. And then gene editing techniques such as CRISPR, they aim to genetically alter or modify the DNA, and the new treatments bring hope to inherited eye diseases. And I think Charles Keepens always mentioned, never say never again to a patient. And I remember one of the first meetings, a public meeting we had in Mumbai that time it was Bombay, in 1991, and he collected along with Dr. Michael Denton for doing genetic study, and all patients were hopeful, but I think he has the patience to explain to the patients about and counseling them, and that way with all the things, and still patients are hopeful. So we are keeping the patient with the hope, but at the same time telling the truth. The promising new treatments are being studied and developed for people with genetic eye disease or retina called gene therapy. This treatment involves replacing non-working genes with healthy copies to slow or halt vision loss. And we are entering an era of new therapy for those who otherwise would become irreversibly blind. For the first time, we are offering hope for this patient and these families and improving quality of life. And Bengaluru-based Narayanathala is developing gene therapy solution that could drastically reduce the cost of treating genetic eye diseases. Currently, gene therapy treatment used to treat about 65 to 70 conditions can cost as high as 8 to 10 crore per dose. And the institute is aiming to cut costs by 70 to 80%, and has also received regulatory approval to conduct clinical trials for gene therapy targeting various eye diseases. And I'm happy to mention Dr. Arka, along with the Professor Kumar Manikvel and Dr. Rohit Shetty, are working on that. The institution also developed a gene repair, regeneration, and ophthalmic workstation called the GROW Lab. The GROW Lab is focused on advancing research into gene therapies for several common but challenging eye diseases. Among them are keratoconus, where the cornea becomes thin and cone-shaped, and RP, a degenerative disease that leads to blindness. Additionally, the lab is tackling ARMD, a leading cause of vision loss in elderly population. And this is from the YouTube, the gene therapy breakthrough could cure blindness.
Jonathan Wyatt had given up all hope of ever reading again. He was just 20 when he was told he had a genetic disorder called choroideremia, and he would slowly go blind. But for the first time, doctors have used gene therapy to correct a DNA defect inside his eye cells, dramatically improving his vision.
When I got home, I looked down at the mobile phone and I said, I can see the vision. I can see the vision. Hey, switch it on. Switch it on, and I said, I can see.
Can you increase the volume?
The first 6 patients treated at the Oxford Eye Hospital were all able to see better in dim light.
So this is where the surgeon's role comes. When the gene therapy is ready, we have to place the gene in the subretinal space. You'll be seeing now they are also trying to use the robot to inject the gene into the submacular space.
Where they inject the virus behind the retina. The virus then infected light-sensitive cells, releasing the gene, which started producing protein that helped to preserve vision.
Rather than taking a pill or proteins or taking tablets, we're actually correcting the disease at the genetic level. In other words, genetically modifying the patients who have the problem to put the gene back that's missing. Obviously, we're very excited because potentially gene replacement is a way of stopping the disease from starting in the first place, and we could genetically modify people to prevent them from getting the disease and hopefully prevent them from losing their sight.
Around 1,000 people in Britain suffer from choroideremia, but the same technique could treat far more common genetic causes of blindness, including age-related macular degeneration. Doctors are so excited by the results published in the Lancet
This is
Medical
a
Journal
subretinal
that they've
injection.
already started another trial. The procedure could be approved.
So there are viral vectors for gene transfer, And the most common method to deliver vectors are intravitreal, but doesn't work much, and that's why the subretinal injection. It's not just a subretinal. You have to do vitreoretinal surgery and go behind the subretinal space, and that's where the skill is required, and as well as I think now the robot they are trying to say so that the injection can be without any tremor, and also fixed amount can be injected into subretinal space. And this video is again from Scientific American, which I borrowed from Professor Kumar a few years back from University College of London.
For sufferers of hereditary blindness, there may be a light at the end of the tunnel. 2 experimental trials have shown that gene therapy could one day cure a rare form of blindness that affects about 2,000 Americans. The research teams tested the treatment on a total of 6 patients. Here you can see how they performed the eye surgery. Prepared genes were injected into the eye of this young visually impaired patient. The eye was infused with air, then reinfused with fluid near the end of the surgery. To measure the patient's performance before and after the treatment, he was guided through an obstacle course. Here you can see how he navigated through the maze prior to the surgery. He bumped into obstacles 6 times and was disoriented twice. It took him 77 seconds to finish the course. 6 months after the treatment, the patient showed a dramatic improvement. He was able to make his way through the maze in 14 seconds without bumping into anything or getting disoriented. He was one of 4 patients that showed an improvement. The treatment also proved to be safe, which has not been the case with previous gene therapy trials.
So thanks to the new scientific, and there are so many advances taking place, and I think the viruses. So this is the one which RP65 gene mutation, which Dr. Kumar Manigal published in Nature, which finally came for the ocular gene therapy, and so I'll just. Okay, this is another video.
Photophobia is a rare genetic disease in which photoreceptors in the retina and underlying vascular layer, known as the
Okay, I think.
choroid.
The first
Yeah.
6
So in summary, vision loss from inheritable disease is a debilitating condition. Genotyping is the key to developing possible gene-based therapies, and many gene therapies are under the pipeline and a ray of hope for the patients. And I think thank you very much for the listening. Any comments or yes?
Ever since the National Rare Disease Policy has come along in India and it was revised in 2022 as well, it has a clause that says that if there's an actionable mutation or an actionable genetic disorder, the government will provide support. And as you mentioned in your slides, the costs go up to like 8 to 10 crores. So do you have any real-time example of any case of an eye disorder where a person is actually utilized, or how the government has supported, even if it's something like sending them abroad for a clinical trial or such?
So I think a lot of patients have approached me, but I have not got any patient who has got a permission. Particularly, so many patients we have retinitis pigmentosa. Nobody, 2 patients were ready to go for a trial, but unfortunately, they're not unfortunately, the patient did not have RP65 mutation. They were actually disappointed they don't have, and I think the expectation of patients are also high. But I don't know about this, whether this particular thing which has come in 22. I'm not aware, Kumar. The government is given, but I don't know whether any patient example, I don't have any patient example where they have benefited from this government scheme.
Yes, actually, what was mentioned is correct. There was an incident in Kerala for another genetic disorder, a rare one, I think it was a spinal muscular atrophy, SMA disorders, for which there was a collection of money which was done as a crowd source. Okay, and they collected the money, and somebody put a case in the court that how you can collect like that, and then it went into a spin, and the medicine came. Apparently, the child died.
Oh,
Okay, so there is an initiative. For example, Government of Tamil Nadu does support rare diseases, and they are ready to do a diagnostic testing. Therapy is still, it is a big question mark because they're very expensive.
yes.
But I think Government of India is very open about it.
Okay, but I don't have any patients. Shailaja, you have any patients? No, where they benefited from government.